And me too.
Okay.
Nearly 26 million people in the U.S. have diabetes. However, about 1/3 of those that have the disease are unaware they have it, according to the American Diabetes Association. Diabetes is a metabolic disorder, but knowing the symptoms caused by diabetes and getting proper treatment and care can greatly reduce the risk of complications associated with the disease. What is diabetes? According to Medical News Today, diabetes is a metabolic disorder in which the blood contains excessive glucose. The body either produces no insulin, insufficient amounts of insulin, or it produces cells that prevent the insulin from being used. All of these result in excessive sugars in the blood. Diabetes can be found in any age group of people. 1 in 400 adolescents have diabetes. 27% of those 65 years of age and older also have diabetes. There are also more men than women with diabetes, and African Americans, Latinos, and Asians are at a higher risk of the disease. There are several different types of diabetes. With type 1 diabetes, the body's immune system destroys cells that create insulin in the pancreas. This is the most often found form of the disease in young adults and in children. However, this is also the least common type. Only 5% of those with diabetes have type 1. With type 2 diabetes, the body produces an insufficient amount of insulin where the cells in the body prevent the insulin from being used. Type 2 diabetes is most common in people 45 years of age and older, but can also be found in young adults. Women can develop gestational diabetes during pregnancy. If a woman has high blood sugar levels before pregnancy, they are more at a risk of developing this. The placenta produces hormones that blocks and restricts the mother's body from properly using the insulin. This is usually developed in the second half of the pregnancy, and most fetal development is complete at this time. So birth defects are not a big problem with this. There are many symptoms and complications associated with diabetes. According to eMedicine Health, these symptoms can present with both type 1 and type 2 diabetes. People with diabetes usually experience fatigue. This is because the body is not using the sugar in the blood for fuel. Excessive thirst, urination, and hunger are also problems. Slow healing wounds, altered mental status, and blurred vision are also associated with diabetes. Several complications can exist. DKA, or diabetic ketone acidosis, is when the body burns fat for energy rather than the sugars. This results in excess glucose in the blood. The onset is normally very slow, over several days or several hours. A person with DKA also has sweet or fruity smelling breath or urine because of the excessive ketones in the blood. Nerve damage is also common, especially in the legs and feet, resulting in numbness and tingling. 2/3 of people with diabetes will die from stroke or heart attack. Monitoring blood pressure and cholesterol can greatly reduce this risk. Hypoglycemia is also associated with diabetes. This is when the blood sugar levels fall below normal levels. The onset is often very rapid and can result in seizures, coma, or death in a very short time. Properly treating and caring for diabetes is very important. There is no known cure for diabetes, but there are treatments. People with type 1 and type 2 diabetes should always monitor their blood sugar. People with type 1 diabetes often have multiple daily injections of insulin. Type 2 diabetics can take insulin or pills or a combination of both. Exercise is also very important. Exercise increases blood flow, which increases the effectiveness of insulin in the blood, and it also helps to stabilize the blood sugars. Nutrition is important. Some foods contain excessive sugars and should be avoided. Millions of people are living with diabetes. The disease can cause serious complications if left undiagnosed, but with proper management and medications, they can be controlled. Anyone with symptoms of diabetes should have it checked out to reduce the risk of more serious complications in the future.